do on daily basis. I look at the genetics of the tumor, because if you have ovarian cancer, if you have lung cancer, if you have breast cancer, and somebody else has breast cancer and lung cancer, ovarian cancer with the same ER positive, that doesn't mean that you have the same kind of cancer. The same way that our fingerprints are different, the same way our cancers are different. But the conventional oncology doesn't look at that. There are failures of conventional treatments in general. And if we don't know that, then we fall into the trap. The fourth cause of death in the United States is using appropriately prescribed medicine. I'm not talking about malpractice. I'm talking about medicine that has been prescribed appropriately and is used. This is fourth cause of death in the United States, because people are not trained and educated about other things that they need to know. One of the important things that people are not taught in the conventional office when they see their oncologist for 2 minutes is diet. Quality of life is extremely important, and that is not also discussed with their oncologist. Every time you see your oncologist, you have to ask your oncologist, what is the intention of care? Is it curative or is it palliative? That is an extremely important question, because if it is palliative, it is up to you if you want to choose that route or not. The other question that you need to ask your oncologist is that, how long am I going to live with the treatment? Is that going to change my overall survival? Because 90% of the time when they use chemotherapy on advanced stage 4 cancers, the overall survival does not change. Cancer may shrink, but that doesn't correlate with overall survival. The patient is going to die in the same amount of time, even when the cancer has shrunk. So you need to ask your oncologist about that question. And then you need to understand that there are other options that you have, including combining what can make the cancer sensitive to those chemotherapies. What caused the cancer from beginning has never been even questioned, because they don't want to know. All they want to know is that when the cancer is there, we're just going to kill it. That's not the way to treat cancer. The cancer is part of your body, is triggered by the stem cells, and the cancer stem cell, that's the lecture that I have next week in Texas about stem cell plasticity and the cancer cell stem cell differentiation therapy, and that's what I do in my clinic. And that's why I say that's the only place that is available, because that's the only way that you can treat the cancer, is going after the cancer stem cells. If you imagine that you have a colony of bees, there is only 1 or 2 queens there, but it's producing all these daughter cells. Those bees are daughter cells, are cancer daughter cells, but there is only 1 or 2 queens there that are stem cells. And those cancer stem cells are not touched by any conventional treatment. I'm not saying that chemotherapy is a wrong thing to do. You have to do it, but you have to combine it with what makes your immune system at the same time enhanced, so you don't get those toxic effects.